With the volume? I think we had one notch from the math.
But now, caller one, can you hear us?
I can hear you. Can you hear me?
Yes. Who am I speaking with?
Brian Tavik with KCRG.
Mic check, can you?
Podium mic check. Test 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Podium mic check. Test 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Did you hear that okay, Brian?
I could, yes.
Wonderful, thank you.
Thank you.
Podium mic check. Test 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Podium mic check. Test 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Podium mic check.
I think you can look after me. And so I just finished and you come up and introduce yourself. That's okay.
Good afternoon. Thank you for taking time to join us today. I'm Cedar Rapids Mayor Brad Hart. The City of Cedar Rapids made the difficult decision to keep our public buildings, including our libraries, closed until at least May 15th. Our transit system, unfortunately, will be closed for that period too. Thankfully, NTS continues to provide transportation for necessary trips, so thanks to NTS. Tomorrow, Gardner Golf Course will open, and on Monday, Ellis Golf Course will open, both with significant changes to protect our employees and the golfers. You know, we've been dealing with and living with this pandemic for more than 6 weeks now. This is our 18th community news conference. I want to thank Caitlin and everyone else who's on the public communications team for working so hard to put these together and to keep our communities informed. In some ways, it feels like it's been more than 6 weeks since we began this fight. The stress and the worry has impacted probably every one of us in a variety of ways. I understand many of you are really struggling, and I know that because many days I struggle with this too. I worry about our community. I worry about our health. I worry about our medical community, our businesses, and their employees. There are just so many people who have a need, and I can't do enough to help. We can't do enough to help. And I know that many of you are dealing with really serious and complex issues in your lives, and I feel for you. This isolation is hard. It's hard to be separated from our friends and from our extended family. Thinking about all the what-ifs can be stressful too. And my point of mentioning all that is that this is difficult for everyone. And so maybe it's time for us to extend some grace to those around us and even to ourselves. There are so many people who are doing everything they can to help. Please continue to do all you can to keep our community strong by staying home whenever you can, practicing social distancing, wearing a mask when you're out in public, and wash your hands frequently. Now is not the time to let up, but that time will come, and hopefully soon. We all know this is a community of hardworking and resilient people who support and care for each other. Together, we will come back stronger than ever. I know it. So thank you for all you're doing to keep our community and our neighboring communities strong, because we are all in this together. Thank you.
Good afternoon. I'm Joel Miller, your Linn County Auditor and Commissioner of Elections. The Linn County Auditor's Office is working with state and local officials to provide for a safe and secure June 2nd primary election. For example, recently I signed a mutual aid agreement with the Johnson County Auditor, pledging that we would assist each other should our personnel or operations be affected by COVID-19. The best thing you can do is vote from home. To encourage voting from home, a couple of weeks ago, our office mailed absentee ballot request forms to all registered voters in Linn County. Thus far, we've received over 25,000 absentee ballot request forms, which far exceeds the number of people who voted in either of the last two primary elections. Please keep in mind, Linn County has over 150,000 registered voters. This week, the Iowa Secretary of State office mailed out additional absentee ballot request forms to every registered voter in the state. If you did not fill out the form from our office, this is your second chance to request a ballot to vote at home. Your response has been tremendous. As of today, we've mailed out over 15,000 absentee ballots, and over 3,200 voted absentee ballots have been returned to us. Please be patient with us. We've hired additional ballot processors. We will continue to process the requests as they are received. Election Day is still more than 4 days away. We have assembled a team of 24 Democratic and Republican citizens who will jointly review and count the absentee ballots starting on June 1st. If you prefer to vote early and in person, the Linn County Auditor's Office will also be offering curbside drive-through voting to all voters near the Linn County Public Service Center. Curbside voters may go to 823 3rd Street Southwest from 8 a.m. to 5 p.m. Monday through Friday, and on Saturday, May 30th. We'll be closed on Memorial Day. Finally, voters may still choose to vote on Election Day, June 2nd. Please note that we are combining our 86 precincts into 19 physical voting locations. Any household containing a registered voter will receive a mailer in mid-May telling them where they should vote. In addition, voters may go to our website to find their temporarily combined voting location. We are aware that election officials in other states are falling ill after working the polls. To protect our workers, we will provide masks and other items as approved by Linn County Public Health. We'd ask that the public take healthy steps if they choose to vote in person on Election Day. Finally, I'd like to give the answers to a few common questions. Any voter may vote in the primary election. If you request a ballot, you must mark on the request form whether you want a Democratic or Republican primary ballot. You must remain a member of the party you select through June 2nd. On June 3rd, you can change your party preference if you so desire by going to the State of Iowa's online voter registration portal or by filling out a form you can find on our website and mailing it to us. Next, please note that you only need to fill out one absentee ballot request form. Regardless of how many you fill out, you will only be issued one ballot. Our goal is to keep our election workers and the public safe while completing a fair and verifiable election. Remember, you count and your vote will count no matter how you vote, whether by mail at home, at our drive-through voting station, or at the polls. I encourage you to stay safe and request a ballot by mail. Vote at home. Thank you.
Good afternoon. My name is Heather Metter, and I am the supervisor for the Clinical Services Branch at Linn County Public Health. As of 3 p.m. today, there are currently 660 cases of COVID-19 in Linn County. We've had 44 deaths, and 424 individuals have recovered. These numbers will be different from what you see on the coronavirus.iowa.gov site. We are very confident in our numbers, and we realize that there may be some discrepancies due to zip codes on the governor's site. We know that there is a team at the state level that's trying to look into this and correct those discrepancies. We continue to track and follow up with outbreaks previously reported at long-term care facilities. If a long-term care facility meets the state's definition of an outbreak, they will be listed on the state website, and we will provide updates. Some facilities are moving towards recovery, which we are now defining as no new cases for 2 incubation periods. An incubation period is 14 days. Therefore, after 28 days of no new cases, a facility would be considered recovered. Currently, at St. Luke's Living Center West in Cedar Rapids, 44 residents and staff have tested positive. There have been 3 deaths associated with this outbreak, and there are 2 staff and residents that have recovered. At Heritage Specialty Care, 112 staff and residents have tested positive. 24 residents have died, and 78 staff and residents have recovered. At Linn Manor, 22 staff and residents have tested positive, 6 residents have died, and 14 staff and residents have recovered. At Manor Care Health Services, 18 residents and staff have tested positive. There has been 1 death associated with this outbreak. 2 of the ill have recovered. Local news outlets have reported the probability of Test Iowa coming to Linn County beginning May 11th. The Iowa Governor's Office is coordinating all of the Test Iowa locations. If you have questions regarding Test Iowa, please visit the Test Iowa website or contact the Governor's Office at 515-281-5211. Linn County Public Health is aware that there are many questions of what it will look like in Linn County when the governor makes a decision to begin the process of reopening. At this time, there is no definitive date on when we will begin to reopen. The current proclamation for Linn County will expire on May 15th. Decisions about what will occur after May 15th will be determined by the governor. We are working with our partners in developing additional guidance for reopening in the coming days and weeks. However, it is important to remember that reopening will not be a return to normal. We need to continue social distancing. Using cloth facial coverings when 6 feet of distance cannot be maintained, not touching our faces, covering sneezes and coughs, cleaning hands often, and staying home when ill. I have several updates from our partners that I'd like to go through. I have an update from Linn Area Partners Active in Disasters on how they continue to work together to meet the needs of our community. In response to COVID-19, local agencies have seen an unprecedented increase in Linn County families seeking food assistance. Several organizations have expanded internal capacity and service delivery networks. HACAP, Heritage, Horizons, Linn County Lifts, Matthew 25, Salvation Army, school districts, faith communities, and many other organizations and individuals are supporting food distribution. If you need information on where to find food resources, dial 211 or 800-244-7431, or visit the Linn Area Partners Active in Disaster website. If you have not previously been in a situation of needing food assistance, but do now, you are not alone. This event has triggered many families to seek food assistance. To apply for the Supplemental Nutrition Assistance Program, SNAP, call the SNAP hotline at 1-855-944-3663, or go online at oasis.iowa.gov. Double Up food bucks may still be available as well. Agencies that participate in the Double Up food bucks include First Avenue Fairway in Cedar Rapids, the Marion Fairway, or New Pioneer Co-op. For more information on participating in Double Up food bucks, visit the Iowa Healthy Estate Initiative website. We are extremely grateful for volunteers stepping forward to assist with food packing, donation, and delivery efforts. If you want to help, there is a food drive this weekend at Lindale Mall. United Way of East Central Iowa, in partnership with Hy-Vee, the City of Cedar Rapids, HACAP, and Horizons, will be collecting food for older adults in our community. In addition to food, they will also be accepting donations of cloth masks for the City of Cedar Rapids Cloth Mask Project. Please visit uweci.org/events for more information on what food is being collected. Many individuals in our community depend on resources in languages other than English. Multilingual resources, including print and videos, are listed on the Linn Area Partners Active in Disaster website. Linn County Public Health is also working on additional resources, which will be added on an ongoing basis. The Catherine McCauley Center is expanding their efforts with resource navigation and support to serve more individuals who speak limited English in the Cedar Rapids and surrounding areas. For help, call Catherine McCauley Center at 319-731-0445 to be connected with a case manager. An interpreter will be available to assist with questions or concerns in the caller's native language. Catherine McCauley Center is able to support community organizations to serve clients who do not speak English as their primary language. These organizations contact Catherine McCauley if you need more information. Thank you.
Good afternoon. I'm Dr. Dustin Arnold, Chief Medical Officer at St. Luke's Hospital. I'm here on behalf of the medical community. I'd like to first report that the critical care capacity and the blood supply at each hospital is in the green level, which is acceptable and continues to function at a high level. We're thankful for the community and their discipline in social isolation and of truly flattening the curve. But we also realize that we're a community, not a curve. And with the governor's proclamation last week that we would restart elective surgeries, the community, medical community has been meeting during the week, and that is the two hospitals, PCI, Linn County Anesthesia, as well as the Surgery Center of Cedar Rapids, and have worked out a plan to return to elective surgeries over 4 phases that will take several weeks to a month to complete. But it's not locked in because we're going to make this decision based upon our guiding principles of protecting our healthcare workers, our patients and staff, minimizing transmission of the contagion, and preventing morbidity and mortality, as well as preserving a functioning healthcare system. So this will be continually reassessed, and I know we're all anxious to get back to work and get some degree of normalcy back in our lives. Thank you.
Hi, I'm Drew Martell with Foundation 2. I just wanted to take a moment to acknowledge and thank all of the essential workers out there. You are the unsung heroes. There are too many to list, really. Shelter employees, healthcare workers, postal workers and delivery drivers, grocery store clerks, pharmacists, truck drivers, electricians, plumbers, farmers, factory and distribution centers, and it could go on and on. You are more than just a cog in our economic machine, but the work you do has been critical for the rest of us to be able to stay at home, and we recognize that, and we are so appreciative of that. You also may experience the emotional toll that working during a pandemic might have on you, in some cases choosing between your economic reality and concerns about your health. It is important to us that if you need support, that you reach out. You can always call the crisis line or the Your Life Iowa number. Those numbers are 319-362-2174 or 855-581-8111. You deserve so much more than just words of sympathy and appreciation. You deserve long-term resource commitment, and employers should look at ways that they can support you in your mental health. Some employers have expanded access to counseling services or purchased access to counseling services to support employees who are deemed essential during this very difficult time. Again, we are so grateful for the work you do, and we know there are many, many of you out there who will never get the recognition that you deserve, and also that a lot of you didn't choose to be essential. But we are thankful for you, and we recognize you. Thank you.
This is the end of the prepared remarks for today. And I'm going to ask our media contacts on the line if there are any questions. I'm going to give one more minute for questions. Looks like no questions from Travis at Channel 7. Thank you. Any other questions for our speakers today? Okay. Go ahead.
Can you hear me?
Yes.
So I have questions as well. I can ask them.
Sure, go ahead. Go ahead, Travis.
This is for Heather. Heather, we've received some concerns about how some of the long-term care facilities are handling the sanitation to stop the spread of the virus. I'm just curious as to how these facilities are working with the county? How is that relationship? How often are you actually checking to make sure that they are taking the proper procedures? And have you heard any concerns about this?
So Travis, I just want to make sure I heard all of your question. You're asking how we work with the long-term care facilities to make sure that they're following proper procedures. Is that correct?
How's the relationship? Are they working well with you?
Are they working? Okay, so our long-term care facilities working well with us. Thank you for that question, Travis,
Yeah.
and for clarifying that. So yes, I think the long-term care facilities have been wonderful to work with, and I do think we have a very good relationship. We are asking them to fill out a survey every day to tell us what their needs are, to look at how many individuals are sick, be it staff or residents. We are also asking them about their PPE needs, their personal protective equipment. So we are asking them to do that. And then when we see things, we are reaching out to them. And so far, they've been very welcoming of any advice, any guidance that we can give. They are following up with that. We speak to them on a daily basis. And we just stress to them that there's nothing punitive about our conversations. Our conversations are there to help them, the staff, and to help the residents. That is our primary concern. We want the residents and the staff to be taken care of. And so that communication's been very open, it's been very honest, and it's been very good. However, I can only speak for what we're doing with Linn County care facilities. I cannot speak for what's happening anywhere else in the state. Does that answer your question, Travis?
This was Brian Tabak.
Oh,
with
I'm
KCRC,
sorry.
and yes,
Brian, I'm sorry. I thought it was Travis. So does that help to answer your
That's okay.
question, Brian?
yes.
Okay, wonderful. Thank you so much, Brian.
I apologize for that, Brian. I hadn't realized you were on the line. Are there any other questions from our media professionals? I think, Brian, you're the last one to have that call. Okay. Hearing none, that does conclude our press conference for today. Our next press conference is scheduled for Monday, May 4th. I just want to have a quick reminder that we do have a virtual town hall scheduled for tomorrow, focusing on personal finance, employment, and legal aid. We'll have speakers from HACAP, Horizons, Iowa Legal Aid, and Iowa Workforce Development that can answer questions regarding that topic. You can find additional details on the Linn County Public Health COVID-19 webpage and our social media channels. In summary, I would just like to briefly repeat the Linn County metrics to date that Heather stated. Linn County has 660 cases, 44 deaths, and 424 that have recovered. Please continue to practice physical distancing, staying home when you're sick, and washing your hands often. Thank you.